Joining us now on set is Dr. Jeffrey Lisiecki, and we're going to be talking about plastic surgery. Welcome to the show. How are you, doctor?
Thank you. I'm great. How are you?
Good. So nice to meet you. Now, you work in New York City,
Yes.
but you're originally from the Midwest, just like me,
Yep.
right?
Absolutely.
Detroit and St. Louis. So I got an opportunity to learn a little bit about you and your journey. What made you decide to become a plastic surgeon?
It started really early in my medical education, actually. When I was at the beginning of medical school, I just answered an email to join a research project, and it was studying burn reconstruction, and it happened to be with someone who was a plastic surgery resident at the time. And I really enjoyed that project, and then he sort of introduced me, he started bringing me into the OR when I was a medical student, and I just sort of learned more about it, and that's kind of it.
There have been a lot of new opportunities for plastic surgeons because there's been a lot of different research and different tools and different things that you're able to do now. What are
Mhm.
some of the trends? What's going on in that field?
I think there are so many right now. Surgically, what we're seeing is, and I'm glad for it, is a return to a lot more of a natural kind of look. Really overdone plastic surgery is not as hot now as it may have been 10 or 20 years ago, and that's a good thing. So a trend towards a lot more natural. And then overall, I think technology is playing a bigger and bigger role in what we do as plastic surgeons. And so I think today's plastic surgeons are becoming and need to be comfortable sort of bridging the gap between using technology, using lasers and energy devices and things like that, and blending that with surgery to get the best results for our patients.
Has there ever been a time when you had to maybe say to a patient, perhaps you've had too much plastic surgery. Can I, offer you some consultation? Because sometimes people could get addicted, like they've
Hmm.
gone under the knife like way, little too much, right?
Yeah.
Okay, so at what point do you like give them a consultation, or even a
Mhm.
new patient? Do you sit down with them and kind of say, "This is what I see for you"?
Absolutely. Yeah, and I think that's one of the most important things that I do in my job is people sometimes come in with I want X procedure done. And sometimes that's a procedure they'd be a good candidate for, and sometimes it's not. Other times, and what I think is a better way to approach it as a patient is to come in and say, this is what bothers me. And then have it be a discussion and make sure you're having good communication with your plastic surgeon about what is good for you and not, what you're a candidate for and not, what's safe and smart or not. A lot of times we see people who have had, and especially with filler being so prevalent nowadays, I see tons of people who just have way too much filler in their lips or in their cheeks, and it's either in the wrong place or just way too much, and we need to take a step back, reevaluate, talk about the overall plan. In the case of filler, sometimes dissolve and refill down the road, or dissolve and replace it with fat graft. In the case of surgery, yeah, sometimes people come in with breast implants that are way, way, way too big, or a BBL that's way, way, way too much. Sometimes they recognize it and they're asking me to help reverse it.
Yeah.
And sometimes they don't, and we need to sort of have that conversation. But I think sort of one of my most important roles is advising people about that sort of thing.
Let's say someone has like a keloid, or which
Hmm.
is a different type of scarring, or like you had mentioned, doing some internship with someone in the burn department. Do you still help with that? Or maybe somebody's got a gash from a trophy
Hmm.
falling on their head. Do you still do that type of plastic surgery too?
Yeah, yeah, absolutely, absolutely. I don't do so much of breast reconstruction after cancer and things like that, but so much of what I do is reconstructive. I mean, it's kind of a silly line to draw between cosmetic surgery and reconstructive surgery
Okay.
because they're kind of they can be very intertwined. Especially rhinoplasty is my favorite procedure, and everyone has had trauma to their nose at some point in time. So much of rhinoplasty is fixing a deviated septum to improve breathing issues or other things that are obstructing the nasal airways, correcting irregularities from past nasal trauma, because who didn't get hit in the nose as a kid? But then also making a nose that looks better and is as beautiful as it is functional.
I always think of rhinoplasty, like with the animal, the rhino, with the
Mhm.
nose, right, with the horn. I have no idea if there's a correlation or a connection between that. Is there? I don't
I
know.
think I think there is.
Okay,
I think rhino the animal is
right.
named that way because it has the same root word for nose.
Understood.
I
Okay.
think so.
Because I was like, funny little things. But every
Yeah.
time I always think to myself, for whatever reason, I always think that that would be a great logo for a plastic surgeon, right? It's just like a rhino, right?
Mhm.
Um, we're joyfully having this conversation today. Is there anything that you would want your patients or future patients to know about you, Dr. Jeffrey?
Mhm. Yeah, yeah, definitely. I think the biggest thing about me and sort of my biggest advice to future patients for anyone is about communication. I think communication is a really, really, really important part of any doctor-patient relationship. I think even more so in what I do, because so much of deciding what is a good route to go has to do with our communication, my understanding of your goals, your understanding of what's possible or why something may or may not be a good idea. And so I think to anyone who's considering plastic surgery or evaluating a plastic surgeon for a procedure, you want to find someone that you like, that you get along with, that you have a good communication with, because that's going to make the whole process much more enjoyable for both of you. And it's going to make the surgeon happier with how things go. It's going to make you as a patient happier with how things go.
And do you also make a timeline for them? So if somebody has a facelift when they're 40, you might say, okay, your care path is going to be like this. At 65, you might want to have this done because
Mhm.
you don't want to have one part of your face look like it's 20 and another part of your face look like it's 85, right?
Absolutely.
Okay.
Yeah, yeah, absolutely. That's something that I always talk about with any procedure is sort of the longevity of the procedure. And for the instance of a facelift, facial aging doesn't just stop the second you have a facelift. It continues on. So a facelift may set you back about 10 years, but time does continue. And so I do talk about that. I say, when you're 50, you'll look 40 roughly.
Okay.
But time does progress down the road. You may notice other problems or other things that you want addressed. And that's where we might get into revisionary procedures, things like fat grafting through the face, things like energy devices to help tighten up skin that starts to loosen a little bit as time goes on. It's also important and I think part of my counseling patients, you mentioned, you don't want part of you to look 40 and part of you to
Right.
look 80. I pretty much the only time I'll suggest something to a patient that they didn't bring up as a concern of their own is something that will create sort of a discordance there.
Okay.
And I think that's time to just sort of say, we're talking about doing a facelift. You may not notice it as much now, but sometimes, when people get that part done, they notice then their eyelids. And just bringing that up, and sometimes doing it all together makes sense, and sometimes doing it piecemeal makes sense for that patient in that circumstance. But I do think that's something that's important to bring up and to help create that communication and that understanding between myself and the patient.
I appreciate that. I appreciate
Mhm.
your candor.
Mhm.
So obviously somebody can go to you and you're going to help them and you'll make some suggestions and I do believe that communication is so important. So
Mhm.
thank you very much for sharing this time with us. I
Absolutely.
look forward to knowing you for a long time. And there are other guests here today. Like I said, part of the fun of coming on the show is that we have a party going on
Mhm.
backstage. So
Yeah.
celebrating you. Thank you so much.
Thank you. Thank you so much for having me.
There you go. Dr. Jeffrey with some trends that are happening in plastic surgery. Stay tuned for more. We're living it up right here.